Each hormone will have its own function. But the one thing that I've actually learned, the thyroid is so important. As when you talk about, the immune system, I've seen a lot of patients who are diagnosed cancer. When they come to me, their T3 is only sitting at 2.9, 2.5, and they are all unaddressed. It's not even corrected. So thyroid also it's very important when it comes to the immune function. Their main complaint is male boobs, right? So with the boobs, it's like, okay, estrogen dominant, where are they getting it from?
Your body is crying for help, and it's whether you hear it or not.
I had a patient who said that, I had this sensation. A lot of people told her to go and see a psychiatrist, but it's actually a menopausal symptom.
As doctors, we think that we are responsible for a patient's health, but then you're disempowering the patients because they are the one that's supposed to be responsible for their health.
Join Disruptive Doctors.
I'm Dr. Selina, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. In Post-Call, we dive into the untold stories of doctors who are breaking the mold, trailblazers who are redefining what it means to be a doctor. This is Post-Call Beyond the White Coat.
Today, we're diving into a deeply personal and transformative story of Dr. Sangeet Kaur. From her early days in medicine to navigating her own health struggles, Dr. Sangeet has learned, unlearned, and grown into a leader in integrative medicine. Now, we're going to explore her story, her expertise in hormone health, and how she's empowering patients and doctors alike to take a more personalized approach to medicine. Hi, Dr. Sangeet. Welcome to the show.
Hey, Dr. Selina, thank you for having me.
Okay, so let's start from the very, very beginning and the human behind the doctor. So who is Dr. Sangeet Kaur, and what does the audience need to know about you?
Okay, so I guess I'm a very dedicated physician, and I'm pretty much deeply rooted in a sense of purpose. So I guess it all goes back to my upbringing. I had a very strict yet humble upbringing. And, my late dad, a doctor himself, he has always been my hero and my inspiration. So, with that, his example has led to the person that I am today. It's been like he instilled a deep commitment towards healing as well as hard working. And for me, my journey thus far, what has literally brought me to where I am is literally following my heart. And I think as part of the personal journey, when we go on later, I think a lot of us aren't really aware. When we make a certain decision, is it coming from our head, which is the ego? Is it coming from our heart? Right. And I have explored the journey, and through healing, what I can actually share from my personal experience is always follow your heart. Because when it comes from the head, we don't know that, we have gone through a certain trauma. It's just part of life. We have all been hurt before. And when it comes to the ego is not bad. What the ego is doing is it's literally protecting us. So the ego forms like a shell around us because it doesn't want us to get hurt. And the biggest lesson is basically we need to heal, right? So as we heal, that particular ego, that shell, will actually crack, and we are able to make decisions that is truly authentic to ourselves. So coming back to, the decisions that I always make is literally what sets my soul on fire, what feeds it, what sets it on fire. And I guess I found that spark in integrative medicine. As we dive, deeper, I will share a little bit more of the story. So when you talk about integrative medicine, what I really like about it is, I blend, the nutrition bit, the hormone balancing, the lifestyle, the exercise, the diet, the whole food, stress management, sleep. And to me, once when you address all this, you are treating the patient holistically, right? You're bringing them back to their wellness. And recently, what I found really, what I'm really drawn to is the healing power of homeopathy, low dose medicine, as well as chronic healing. So I've kind of found my passion in this, and I'm just trying to learn and enjoy it. And I guess, Selina, you'll probably agree with me, being in this particular industry, we always have to continuously learn. There's no such thing as we have to stop learning, we are done, and that's it. We can close our books. It's a constant journey of evolving and growing.
I absolutely agree. And what's more interesting is as you go on this journey, you realize you have to unlearn so many things. What was taught to you, you have to start questioning it. I used to think a lot of things were set in stone. Whatever that's in my medical textbook, that is set in stone, and that is my Bible, and that is how I will operate as a doctor. It was, I think, only when I became a patient, that's when I had to pull the handbrakes and I started thinking to myself, like, wow, is this how I've been treating all my patients? No empathy, really not listening to what they want. I was just pushing down all the treatment that I think this treatment is for you. You just have to take it. There's no discussion because this is what I learned in medical school. This is what we've been taught. This is what CME has been training us. This is all my training in my clinical career has taught me, and this is what you need. I think when I went through that I had Graves' disease, and when I became a patient, I started to see, wow, no patients really want to be treated that way.
Absolutely. Look, I totally resonate with what you said. And, you said a very important keyword once you became a patient. So I truly believe that all doctors are patients themselves because we have all been put through this whole pressure cooker thing, right? So much of stress. I'm sure like 90%, if not 99% or 100% of doctors, we all have been burned out, adrenal fatigue. So I guess that's where my personal journey was as well. And, all this learning, unlearning, relearning, it has been part of my personal journey, and it has been a humbling one. I guess, a lot of times, I think personal boundary is very important. We always put others first. What about, so to me, the self-love and self-care, it was a huge revelation to me. I never knew that until I went through my midlife crisis, which is like, around my 40s. But, having gone through that, I will instill this concept, self-love, self-care to my children, my nieces, any youngsters, so that they can care for themselves. Don't come to an extent where we are totally burnt out and then we go through this crisis and then only we start learning. So for me, I guess, yeah, I was a particular discovering myself at a later age, but I'm so glad that I was on board with that journey. So I would say that, nurturing, especially parts of me where I neglected my own needs, that self-care and nourishing, my mind, body, spirit. So that was a very humbling journey. And that was when I realized that, what, this whole concept, the analogy we always give, your cup has to be full first. It has to be overflowing. Then we can care for the people around us. The same analogy they will give, when you talk about, the oxygen mask, when the oxygen in the air flight, the whole pressure goes down, you put it on yourself before you put it on the person next to you. It's just the same thing.
So, I mean, I've heard you mention a few things: healing, self-love, personal journey. I mean, you're learning to love yourself. But, as doctors, we've been taught to be very scientific, very evidence-based. It needs to be in the textbook. There's no space for emotions. Like in my 5 years of studying, I don't think I've really dived into any topics that has anything to do with emotions. And so how do you, and all this healing is, it feels like a very woo woo mumbo jumbo kind of words that are thrown out there. But as doctors, we've always been taught that we need to be scientific. So how do you how do you bring this all together?
And see, we were never taught about EQ, right? Emotional intelligence and all that. This was never taught in school. School, college, university, it's always taught revolving everything around academic. You got to be successful, you got to be, very career driven, this, that. So all of us are literally on that path. But when it comes to a certain part in our life, when you talk about relationships, nothing of that sort has ever been taught to us. And I truly believe that the part where a lot of human beings, a lot of individuals that struggles is actually on the emotional aspect, right? You have got your spiritual, you've got your physical, you've got your mental and emotional. When you talk about all those elements, in my experience, just not personally, when I talk around people and, as we go through the healing journey, a lot of people struggle with emotional aspect. Don't you agree?
Yeah, yes. Even I've struggled. Like when I was diagnosed with Graves, I didn't go through of course, I did go through the conventional medicine, taking medication. And then there was a point I was told I needed radioactive iodine. That's when I took a break and the heart stopped and started looking around. And I realized that there were other modalities that actually helped me a lot. Some of it, a huge portion of it was dealing with the emotional baggage that I carried with me. And I needed to deal with it. And it wasn't through conventional medicine, pill popping that helped me through it. It was really on clinical hypnotherapy, me really sitting down and looking at what's staring me in the face, my emotions that I've not addressed. And as I dealt with them one by one, that was when I started to get off my own medication. So yeah, I mean, to answer your question, yes, I think we all have all those emotional issues that I think I'm not sure whether it's just me, but I feel like as doctors, we don't have any tools to really deal with this. We're not taught how to handle this. It's all academic. If you have this disease, take this medication. If you have this disease, is it operable, not operable? And that's how we've been taught to function, never really on the human aspect, if you get what I mean.
I totally agree. And that was when you talk about this dealing with these emotions and all that, and that was when it took a toll in my marriage. And it was a lot of discovery. So, sorry, Selena, have you been married before? Are you married or anything?
I just got engaged.
Congratulations. So, so I was married for 15 years. And the interesting part is like, after about 10 years, they'll say, hey, you're not the same person you were. Obviously, we are human beings. Evolution is part of the process, right? Now, as I evolve, I just realized that the person that I was and the person I was becoming, it's like, the gap became even bigger. And the things like, whether you call it the pattern or the habits or the duties that I used to, abide, agree to, I begin to question those, especially putting myself at last, avoiding conflict, right? Because you want to maintain the peace. In Punjabi, there's a saying that says, ek chup sab sukh, meaning that if you keep quiet, there will be abundance of happiness. And that was when I thought, hey, I think communication is key. So it was also my learning process. So coming back to those, like, all the things that I used to settle, I realized I began to question those because those were all the conditioning, right? And I noticed that, this conditioning, you call it conditioning or you call it childhood trauma or whatsoever, it is all deeply rooted in our childhood. And it's that similar pattern, that familiarity, we tend to bring it onto our marriage, when it comes to our relationships and stuff like that. So to me, that was a huge revelation. That was when I went through the space of questioning. I had a lot of existential questions like, and who I want to be, as I mentioned. So as that gap, grew bigger, that created a lot of challenges because I was told, hey, you have changed, you're no longer the same person. And, with that, of course, it became a very, very painful decision that led to divorce. And to me, sometimes I feel that growth, right, as you go through that growth, after some time, if it doesn't align with it means letting go of things that doesn't align to your truth. So everything for me, it became a question of, is this my truth? Is this my life purpose? Am I aligned with it? So if anything that, I chose alignment rather than, familiarity, and so self-respect rather than self-abandonment. So it was a very painful process. So to answer your question, a lot of it emotional maturation, emotional development, that spiritual part, everything came there. Because it was a very painful process, especially when you have a family, children. Then it became, to deal with the pain, I guess it went through the spiritual process that involved, I needed to meditate, I needed to, find the inner peace. So everything it's a very deep reflection, going back to my inner self, and healing.
Dr. Sangeet, what actually happened? Like, walk us through your journey. Like, when did your personal journey took a turn? I mean, I know you mentioned you had health struggles, and then you started going through all this journey of trying to find yourself again, and it took a toll on your marriage? I mean, it changed the way you are, and then it created this chasm. Walk us through that whole thing.
So it all began at 37, right? 37 was when I was like constantly plagued with, migraines, headaches, the brain fog. I kid you not, it was not funny at all. At 37, I'm like, I keep forgetting my words, and, it will create a toll in a marriage as well, because, if you are married to someone who's, highly intellect, and, it creates a challenge when it comes to communication, right? So that fatigue, all those, it really took a toll on me. Now, when I did my blood test, I thought, okay, let's just look into deeper. So conventional, the lab test, it just, we normally do the baseline, right? As a GP, you just do the baseline. So all that showed in the parameter was elevated cholesterol. And my cardiologist told me you just need to go on a statin, and that was something that I instinctively, resisted. And, so thanks to a great friend of mine, because I was really, really looking into the root cause of what has led to this elevated cholesterol at such a, at 37. So she encouraged me to attend this conference, and it was known as the anti-aging then. And that was when I met my future mentor. So under his guidance, so it was the turning point of my life already there, right? So he became my mentor. We did a comprehensive blood test, and that went beyond just the baseline. We did a comprehensive, thyroid panel where it's just not the TSH and the T4. We included the BT3, and that was when I learned the terms like optimum levels, right? Rather than just normal within the range. And guess what? My T3 was only sitting at 3.5. It was falling off the bandwagon, because the range normally that's given is 3.5 to about 6. And I was sitting at 3.5. And my cortisol was only about 150. My DHA was only at about sitting at about 5. So these levels were literally very, very low.
But in a
So
conventional GP, I mean, if you look at it, it's like, it's okay, it's normal.
yeah, the word normal is used, but these are the parameters that was not even done during those time. It's only done by the endocrinologist, right? So when I did this, and of course mainstream would, so my condition was literally subclinical hypothyroidism and adrenal burnout, which conventional medicine or mainstream wouldn't have detected. So it went undetected. Now, under his guidance, his name is Dr. Anu. And, within 6 months, I regained my life. It was really, really life changing. And I was like so grateful. 3 to 9 months, my energy got better, the brain fog totally clear out. And that's when I knew what clarity was all about. It's like saying that, you never know what darkness is till you lose it, right? Then you know the difference between light and dark. And this was mental clarity. The brain fog totally, it all shifted. From then on, because it was so life changing, I knew that this is the practice that I was going to bring, to my clients, to the patients, to offer them not just healing, but it's also like, a transformative process to thriving. So I guess that was when all the changes started to build up, small things that literally over a period of time, over years, that it led to a lot of things, right?
So how did that continue to grow and change you?
That was when, like I mentioned earlier, right? I never knew the self, because in order for me to heal, I had to take care of myself. See, adrenal burnout, adrenal fatigue, all happens when you put others first, you prioritize others. You are last on the list, right? There's no self-care, there's no self-love. So so it meant that I was neglecting myself. I never had any boundaries. I neglected my own needs. So with all that, the changes, slowly it started to build up, self-discovery, prioritizing myself, putting boundaries. Yeah,
And that led to your growth and that drifting apart in the marriage.
absolutely. Absolutely. So that was when I guess that big shift came about.
Okay.
But
So
there's no blame, but there's just no blame. It's because the one thing that I learned is, you know what, if a lot of us do not know that we actually have childhood conditioning or any trauma. And what I realized that if you don't heal all those, you're going to manifest it in your marriage somehow,
can you
right?
briefly talk about what exactly is childhood trauma and it manifesting? I mean, some people may know of it, but just briefly, what is it exactly?
For every individual, it could be different. For me, it was basically, especially my mom, so I had a bit of a mommy issue, because I could never really understand her. And to me, it took a very long time, that if you can't really understand a person, you just accept them as they are. Because my mom came from India, so she came from a particular village where her upbringing was very different. You don't communicate freely. You do what you are told. And I, as a child, I guess, my personality I was more of a rebellious person. I became more rebellious because when I was told not to question or just told to do what you are told to do, I will always question back. And, so when I was told to silence and, at that point of time, it was a lot of scolding and, they'll use the rotan and stuff like that. Today, if you look back, that is known as, hey, man, that's child abuse. So I could tell my mom, I said, that kind of upbringing today is called as child abuse. You cannot hit me. Why did you hit me? And, things like that. So but as a child, how do you know? Now is when, like, when you become an adult, you have to heal your inner child, because your inner child was the one that is totally traumatized. And because I follow, have you heard of Dr. Shefali Negi? She's one of this conscious parenting. She's on Mind Valley.
Yep, I've seen her work.
So with the conscious parenting, it's like, I really learn a lot, and I just realized that, okay, I had to break that pattern. So part of my healing is breaking the pattern. I sort of like protected, shielded my children. And I knew that, sometimes they always say either you become identical to your upbringing or you become just the opposite, because you know what that trauma is, you know what that hurt is, and you don't want to bring that upon your own offspring. So to me, it's like changing the parenting style, changing the motherhood. So it's like as if it all ended at my generation. So, my children, they're all protected. Their upbringing is totally different. But yeah, so to me, when I look back, I am the person that I am because of my mother. She was like more like a teacher in my life in a spiritual sense. Yeah, I may not have had that kind of close bonding with my mom, but it was very different. We were not like friends, but in a different way, she came into my life as a teacher, because I've always been a very sensitive person, a very sensitive soul. So I guess with her kind of upbringing, it literally toughened me up as an individual, being that, building that mental resilience in order just not to survive, but to thrive. Yeah.
Sounds like we had almost similar childhood. the
Really?
Yeah. So yeah, I realized that, how, like you said, as adults, when you look back, you realize that, oh, that is child abuse. That's not how it should be done. And it's up to us to stop it and change it. And yeah, I've actually read quite a lot of things about childhood trauma, how you bring it on with you in your adulthood, looking for validation, getting into bad relationships, all because of something that was conditioned when you were young.
Absolutely. Absolutely. So I think a lot of us would have gone through, I think a lot of us would probably resonate. It's just that we don't come up and, we don't talk about it much. And it's only true when you go through counseling or certain therapy and, the psychologist will actually make us realize that, hey, you got to look deeper. Where did that come from? Where did that decision come from? Or did it come from you? Or did it come from your parents? What sort of upbringing was it? What sort of environment did your parents, did they grow? So, yeah, a lot of deep reflection, deep revelation, and it made me feel more compassion towards them, especially my mother.
Okay, now let's dive into your expertise, Dr. Sangeet. It's hormones, right? You are the expert on hormones. So, what exactly are hormones?
So, if you open any kind of medical book definition, just look at it that, our hormones are basically it's chemical messengers, and it's produced by our endocrine glands. Endocrine gland could be anything from pituitary, like, where it produces the growth hormone, or even pancreas, where it secretes the insulin. Then you talk about the thyroid. There's a book just now about, underactive thyroid. You look at the free T3, T4, TSH, and you have all these glands like ovaries, estrogen, progesterone, the testicles, where it produces the testosterone, so on and so forth. So now what happens is all these hormones basically through the bloodstream, it goes to our organs, our tissue, where it exerts its bodily functions. Right now, and it's very important that all these basically, when we talk about the bodily function, it goes into our cells. So it exerts its cellular healing or, functions, right? So when we talk about addressing the underlying cause, we always look at this particular, what are the triggers where it goes beyond, the hormones. We've got to look into our nutrition. We've got to look into our gut health. We've got to look into our sleep, how we manage our stress. So all those things, and exercise are so important. So everything, all healing begins in cellular levels. All healing starts from our gut health.
Mark your calendar for Disruptive Doctors annual conference and exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
So what do hormones do in our body?
So each hormone will have its own function. So when you talk about thyroid, hey, it's very important in terms of metabolism, right? So when you have, whether it's hypothyroid or hyperthyroid, just the opposite, either your metabolism gets affected. So either you lose so much of weight in hyperthyroid, or Graves' disease, or Hashimoto's, over time it becomes, metabolism slows down, then you end up gaining weight. And, the one thing that I've actually learned, the thyroid is so important, especially for women, not just women, but for men, because it governs everything from head to toes. When you talk about, the immune system, I've seen a lot of patients who are diagnosed cancer. When they come to me, their T3 is only sitting at 2.9, 2.5, and they are all unaddressed. It's not even corrected. Thyroid, also it's very important when it comes to the immune function. Okay, and then when you talk about the heart health, arrhythmia, so your thyroid has to be optimum, because if it's like too low, even hypothyroid, when you have all this mixed edema, but that is only towards an extreme, ultimately you go into heart failure because it affects your heart rhythm, right? Arrhythmia and all that. So each of it will have its own function. Then you talk about the estrogen. So the estrogen levels and all that, it varies right from puberty to, pregnancy, and then to menopause. So estrogen itself, when you talk about governing, whether you're talking about your youthfulness or your collagen, your mental health, and mental health is so important, right? When you talk about hormones, whether it's thyroid or whether it's the estrogen, and being, the cognitive function, when it declines, you just realize that you have brain fog, you have, like, so all the hormones it actually governs. So testosterone is also another thing where most people think it's only linked to libido. Do you know how many women are diagnosed ADHD when they're going through perimenopause, menopause? So testosterone to me is also very important, just not for men, but for women. So women may require only a very small amount, but that small amount has got such a profound impact. Not just, it goes beyond the sexual health. It's for your mental health, the cognitive function, the mental clarity, the reducing ADHD, to our muscle mass, because we lose a lot of muscle, like about 15% in a decade once we are hitting perimenopause towards menopause. And then you talk about the bone density to prevent osteopenic osteoporosis. So it has its own functions there as well. Yeah, so we can go on talking, about hormones and each of it and its function.
What is I heard you mention this term optimum range or optimum number, because usually, when you take a blood test, there's a range, and sometimes the range could be so wide. So what is optimum number or range?
Yeah, so that's something that I first discovered, which I thought it was also life changing for me, because conventionally we are taught, right, if the range is between, let's say they put 1 to about 11, as long as it's within the range, even though it's sitting at 2, it's considered as normal. But what was truly life changing for me is you have to hit that optimum. So optimum means you try to address, make it 75 percentile. So between that, from 1 to about 11, I would say it's about 7.5, because the optimum level is a true determinant of how a person look and feel. It's bringing us back in our 35, so especially around that particular age group where we function optimally. So even though we are in our 40s or already in our 50s, I always try to keep it as optimum level.
Well, this is a new concept for me also, because before this, I mean, when we're practicing, as long as it falls in between this normal range, like, okay, there's nothing I need to do, or it's almost like there's nothing else I can do for you. I remember saying that to the patient, like, it's already this, even though you have all the symptoms, but it already shows it's normal. There's nothing more I can do. I remember this was the thought process I had when I was sitting in the clinic treating patients. And yeah, it felt so disempowering that I could not do more for them.
I was there too until, my own personal journey that led me to this anti-aging and my mentor. It was really life-changing. So we've all been through that, but now I guess there's more awareness. Thankfully, after that, when I first started practicing this hormonal balancing, that was back in 2007, 2008. We were known as quack doctors. It was really challenging at that time because we were questioned by the endocrinologists, by the gynecologist. But thankfully today, it's known as integrative, it's known as functional medicine, and it's widely endorsed. So sometimes I feel my personal message to all doctors out there is just believe in yourself.
So when you earlier you mentioned, you all were seen as quack doctors, looked down, questioned by all these endocrinologists. Like, is there a particular incident, like, it made you question, like, am I really doing the right thing?
Because of my personal journey, I didn't doubt myself. I was confident that now the awareness is not there, but over a period of time. Yes, like sometimes it's a very slow process. You got to give it about 20 years. You got to give it about 15 years. But what was important for me at that point of time is to protect myself. So what I would do is that was when I realized the power of education. I would educate my patients, spend quality time with them, especially when they have done the comprehensive blood test, go through the profile with them, explain to them, educate them, give them like resources, give them links, give them books that they can, themselves buy and, you know, get support, get educated, learn. And only if they are convinced and if that is what they want, come back, and we start on this. But I used to get them to sign the consent. Yeah.
Would just curious, like what, like I'm sure. Okay, I have this doctor. She mentioned that she was a GP. Her patient had, I'm not sure whether it was already ESRF or CKD stage 4, and he had a host of other medical issues, and he was like on so many medication. So what she did was her intention was to help this patient reduce his medication and to improve his kidney function, and I think he was also diabetic. So her intention was to help him improve all these numbers. So she changed his diet and started giving him supplements and all of that, and could see that his numbers were like the EGFR was improving, the HbA1c was improving. But all these CKD patients, they actually do have a long-term follow-up in the hospitals as well. So when he went for his follow-up, the doctor in the department called up this doctor who was my friend, who was helping the patient to improve his numbers, and she said that I'm going to report you to KKM if you continue to do this, because she was telling him, she was giving him supplementation and she was slowly tapering some of the medication down. So the KKM, the doctor in the hospital, called and threatened to revoke, to make a complaint so that they will revoke her license. Did you encounter anything like that?
Similar, yes, but that my patient, because I educated her, I was already aware about all this. So our main threats are basically our colleagues, whether they're the endocrinologists and all that stuff. So to me, I think empowering the patient. So that patient stepped in and said, "No, doc, it's literally, I think I believe what she said. I believe what Dr. Sangeet is doing because, I have read up, I have found, certain links and there is a scientific evidence." So thankfully that sort of like protected because the doctor wanted to speak to me and said, "You put her online, I will talk to her." So she was the one who actually said no. And the funny thing was, the doctor was questioning why I gave her DHEA. And in his mind, when he was explaining, in his mind was, they have this EPA, DHA. In his mind was DHA. So he didn't know. This is a specialist who didn't know the difference between DHEA and DHA.
Can you explain the difference?
When you talk about EPA, DHA, those are what you find in the omega-3, right? So omega-3 is totally different from hormones, DHEA. So I think it's just in his mind, he didn't think that the difference. But it's only when you expose yourself to all this, you will be aware. So to me, that is just, he wasn't aware. But you know what? Somehow it's the defensiveness I notice that comes in play. So as I say, always educate your patients, give them time. You don't have to like say, "Hey, you know what, let's go on this." Let them come back to you.
Yeah, I think this is so important because I'm just reflecting on the time when I was still practicing. I will only practice what is thought to me, and I will not even entertain the thought of, is there other ways of practicing medicine? Is there something else I can provide to my patients? Like, I would not even entertain those thoughts. Yeah. So if I'm reflecting back, I was one of those doctors who were just in that shell, never thought that I needed to continue learning and like updating my knowledge, and knowing that knowledge does get outdated because more and more research will come out and it will show that, hey, maybe the old way of practicing is not right anymore.
Absolutely. I totally agree with that. As I say, it's an ongoing journey. Medicine is evolving. There's a lot of things. Like now, we're talking about homeopathy post-pandemic, how we see all the autoimmune cases rising, cancer. So what do we do? Obviously we have to look for other means as long as it doesn't do any harm. And it's a modality of healing the patient and treating them, giving them the quality of life or even prolonging their life. Why not?
So I came across this term, beauty hormone. So why is estrogen called the beauty hormone?
It's because estrogen, it supports the collagen, it supports skin elasticity, it helps to hydrate our skin. Estrogen is one, the other is also the DHEA, which is known as the hormone of youth. It also has that particular support as well, function. So I guess, and when you talk about your hair and your nails, right? So you see all the changes that happens when a woman is going through perimenopause, menopause. They start losing their hair. And then, you look at their skin, it becomes, they tend to develop all the wrinkles and the fine lines. So that is the power of the hormones, and especially the estrogen or even growth hormone. So yeah,
Well, what's the benchmark of like the optimum level for estrogen?
it depends on a woman, which part of the face that she is. But I normally keep them when you talk about now the units also matters, right? So if you look at a person in their late 30s, 40s, their estrogen I'll keep between 150 to 250 picogram per deciliter. So sometimes it comes in nanomole because I've been taught by Dr. Anoop, the range that I would normally use is in picograms. So I just tend to convert it. But you can request the lab to give you in that particular unit as well.
Okay, sometimes when women when they get pregnant, sometimes they're glowing and they're really pretty, and you can see it in their face and all that. Is it from the estrogen or progesterone? Like, what is it?
I think it's both, more so the estrogen as well, because that's the one that really peaks, especially from the beginning. And then, when you hit the first trimester, then the placenta will start secreting all the progesterone. So I think it's a combination of both. Yeah, they will always glow and, you can see the skin, but very few, they actually end up in having a lot of acne breakout. Like my mom, she had melasma when she, it was called proesma during pregnancy. So I think that was one of the reasons also she was like, when I carried the two boys, your brothers, I never had any issues when I was carrying you, and you gave me this on my face. So she had that particular butterfly. And that was one of the reasons I really like, you want validation, right? Oh my God, I did this to my mom. I have to treat her now. So I did my diploma in dermatology and that. So I tried to, minimize those. So a lot of people have different issues. Some of them may have chloresma, some of them may have acne, but very few. Most they will glow.
Is it possible? I mean, then postpartum, everything goes back to normal. Is there a way to maintain that kind of glow postpartum and forever?
Oh, forever. I wish there was such a magic concoction that we can say forever. But, I guess what is actually important postpartum, I would say, is the mental health, because I personally, I never knew what postpartum blue was until I realized, why am I tearing? Why am I feeling so sad? I mean, this is my firstborn, but as doctors, right, there's a huge shift of our lifestyle. We are working and suddenly we are confined to the four walls. And I was so committed because I was in pediatric department for about 5 years. I was trained in pediatrics, so determined to breastfeed as long as I could. And my son, breast milk, right? It's not, you will feel hungry because you have the full milk, you have the high milk. It's not like formula milk where you feel full. He was like constantly after 3 hours, wet, cry. 3 hours, and I was constantly breastfeeding and I was like, oh my God, I felt so tired. The one thing that, that I dread during breastfeeding was I was so totally sleep deprived. And, with the sudden drop in the hormones, I had postpartum blues, but thank God I was aware and, it just lasted me for less than a week. That was when I just realized, okay, I got to step out of the house. I need to go out for my work. And that awareness was there.
Also,
And support, the
sorry,
support
go
is
on.
so important. Yeah, so the support from your partner and all that is really important. Because sometimes they're like, what's wrong with you? Why are you so like negative?
I heard you say there's a drop in the hormone, and that caused your postpartum blues to really manifest. Does hormone cause like changes in our mood?
It does. Different scenarios, right? So let's go back to the postpartum blue. So what happens? Postpartum blue is actually due to the drop in the progesterone levels. Now, progesterone, as we know, so when you talk about the hormones, right? So each hormone regulates our neurotransmitters. So, for example, our estrogen, it regulates the serotonin. So serotonin is the happy hormone. Okay, and the progesterone is it regulates the GABA. GABA stands for GABA aminobutyric acid, which keeps a woman calm. It's a natural tranquilizer. We sleep better. So, and it keeps us calm. So, when the drop of the progesterone is so significant, it leads to a lot of depressive symptoms, low mood, anxiety that happens. So that's also one that, you have that your estrogen is here and your progesterone is here. So any discrepancy of hormones where it's not balanced, you will have the low mood, the depressive symptoms. So too much of something is also on the reverse. It's never good. It's all about balance. It's all about homeostasis.
So, all those PMS just before you get your menses, I mean, at least I feel it. Like there's change in my mood. I can feel a bit of a difference. Like I'm not as motivated as I usually am. Is this all also due to that?
Yes, PMS usually, different individuals. So this is why for me, I really like the concept of personalized or tailor-made compounding or treatment protocol because we are all very individual. We are unique beings, right? Your PMS may be moved. My PMS was headache, breast tenderness, and some of them they get very irritable, they get very aggressive, things like that. So each of us will have different symptoms. So yes, so it makes a difference in individual levels, but a lot of majority of the time, the PMS is due to estrogen dominance.
What is estrogen dominance?
So estrogen dominance, when you compare the levels, progesterone, as I mentioned just now, it has to be like homeostasis, it has to be a balance. So things like PMS, fibroids, endometriosis, you have all those headaches, all those are due to estrogen dominance. And a lot of women are diagnosed PCOS, right? Polycystic ovarian syndrome. Now that is also due to estrogen dominance. So when you look at it, the progesterone levels are usually low. Now, one of the reasons a lot of the younger generations, so those were the days, the benchmark to have to attain menarche, the first menses, used to be about 12 years old. These days, you hear about 9 years old, 10 years old. So what's happening? So this is when we tend to look at the environment. There's a term used, the xenoestrogens. So we are getting all these additional estrogens from our environment, be it whether it's the plastic bottles or water that is contaminated, with estrogen, when you talk about the air that we are inhaling, all those microplastics in the environment, perfumes to makeups to whatever. Hence, all these, we're having a lot more xenoestrogens, and these are not the healthy ones.
So this is causing the early puberty in children these days.
Early puberty in children, a lot of PMSs, a lot of all this estrogen dominance related health issues, especially among women. The fibroids, the endometriosis, the PCOS, all those.
This xenoestrogen also affecting men?
I'm sure to a certain extent it also is affecting them, but not as much as women. We say we women we need more estrogen, and as it is our ovaries are already producing adequate estrogen, and then on top of that you're getting these additional estrogens from the environment. Right, so if you look at it, it won't affect the men as how it's affecting women. So a lot of men, they tend to either it's due to their diet, whether it's too much of caffeine, too much of alcohol. That's when it affects them. And a lot of them, when they come, their main complaint is male boobs, right? So with the boobs, it's like, okay, estrogen dominant, where are they getting it from? And just by addressing, I've had a teenager who had that boobs. Of course, he was very embarrassed, peer pressure and all that. He was being teased. And I found out that he was having hope, a number of that he has in a day, it's about 4 to 5. And just by eliminating the hope itself, because that caffeine that triggers that, he lost the male boobs. Of course, he lost weight as well. Put him on a proper diet, put him on a proper exercise, and you don't need any medication.
So what about for all these women where they are now estrogen dominant? Must something be done? And if yes, what is it that should be done?
So normally what I will do is basically take a detailed history. The menstrual history is so important, whether it's their hormones, are they regulating their cycles, their menses or not. Once the detailed history, clinical symptoms, or physical examination, look for other signs and just get a very thorough hormone panel done. Now, normally I just don't run a hormone panel. I will also do vitamin D. I will check the homocysteine. I will check the fasting serum insulin, inflammatory markers like CRP. And once the blood report comes back, just go through at them and address. You will definitely find something is totally wrong and address the root cause, whether it's balancing the hormones or. But I always am an advocate of the 5 pillars of health. So it goes beyond the hormones, addressing the gut health, addressing the nutrition, the sleep, the stress management, addressing those, balanced diet, healthy balanced diet, whole food. Yeah.
Should a doctor test a patient's or a client's hormone levels on a regular basis?
When patients they come to us, there's always a reason. If they're healthy, if they are, balanced, they will not come and see us, right? If they're totally stable. So when they come to us, we just need to listen to them, find out what is bothering them. And you will always find that there will be something always related, almost if not always related to the hormones. Because, things like moods, mental health, if they're feeling depressed, you already have to start thinking thyroid, right? And then you got to start thinking, is there an estrogen dominance? Is the progesterone low? And then you got to start looking into the vitamin D because vitamin D plays an important role in mental health, right? When you talk about those were the days where they said vitamin D is a vitamin. Yes, it says vitamin. The name suggests it's a vitamin. You look into the structure, it's like a pro hormone. And when you look into the function, it's actually a hormone, right? So vitamin D is linked to polycystic. Vitamin D is linked to depression. So get a full thorough panel done, get the history taken. Definitely you will find there is something that is totally off. Because once when you do a certain blood test, when the levels are totally off or something, your body is already manifesting, it's already crying out for help. It's just that whether you pick it up or not. So you got to be really aware. As a doctor, you really need to be aware as to what is totally off and where we can help the patient.
Well, I like what you just said. Your body is crying for help, and it's whether you hear it or not. Most of the time, I think, at least I'm going to speak for myself and my experience. I think my body was crying for help for a long time, but I was just ignoring because the blood results look okay. If you're going to talk about your body, it's very subjective, right? But if it's like blood tests, that's objective. You can see it, but it also depends if you're actually testing for it or not.
Absolutely. So, and I guess we all went through the similar health issues because that was when we challenged the status quo, right? Conventional has said this, but hey, you start to question that I don't want to go on statins. Is there something I'm missing? So I guess that's when the awareness comes because one thing for sure is, when you say that a lot of us neglected our own health, so did I. But it comes to a point where I think you are put on a spot where you start to question. That's when we start to look deeper. That's when we start to look into the root cause. And a lot of women, because now there's a huge movement on the F factor. So I talk a lot about menopause and, preparing women for the shift, from the whole transition from perimenopause to menopause. Because a lot of women aren't aware of their body as well, right? Because menopause, perimenopause symptoms could include weird symptoms. It's not straightforward hot flushes. It could be burning sensation in the tongue. So I had one who said that, and she thought something was wrong up here. And I said, no, that is actually a symptom of menopause. She was so relieved, almost in tears, because she was told it's in her head. Coming to awareness, we have to be there creating the awareness to say, look, this is normal. This is one of the not so common symptoms, including creepy, crawly sensation. So when I had a patient who said that, I had this sensation, a lot of people told her to go and see a psychiatrist, but it's actually a menopausal symptom. So we have to create the awareness, we have to spread the awareness, educate, and help others to get the support. Resources we have to come up. So we ourselves have to be so aware.
Yeah, is it That's so true, like textbook is textbook, but I think it has not evolved fast enough with whatever that's happening with patients, healthcare, and all of that. Because a lot of the symptoms, like when I was going through Graves, it was an impending storm, and I didn't really have exactly all the symptoms exactly as per textbook. And even for instance, I had this heat intolerance. It was just, it was not clear. I just thought that, okay, I just don't like the heat. But, your body is literally burning. You just want to strip your clothes off and dunk yourself into cold water. That was what it was. It wasn't just intolerance. It was like burning hot sensation.
Fire.
Yes, on fire, literally. And then when I had a slip disc, they always say you'll get this electric shock sensation down your leg if it's a sciatica, but it was none of that. I had cramping pains. Every movement just gave me cramping pains, and it was so scary because as a doctor, I don't even know what was going on. So I can only imagine how scary it would be for patients.
Yeah. So, what did you do how did you get help? How did you find out, that it was something more than just what you were dealing with and you actually went to the root cause? What was your awakening moment?
Okay, so I was on medication. I was put on, I mean, after they dealt with the emergency, and then I got home and I was put on carbimazole. I was told, okay, take this for 2 years and then we'll review and then we'll try to taper off. So for the 2 years, I took the medication diligently as prescribed. I changed nothing about my life. Everything stayed exactly the same. And then was at the 2 year mark, they said, okay, let's just taper off. And it was a very fast taper off. It was like 5 days, 3 days, and then just off or something like that. And I was like, are you sure? I don't feel that I'm ready for this because I feel like something is still wrong. And I was like, no, 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 don't worry, it'll be fine. True enough, within 3 months, everything just rebounded. My T4 was like 99. My TSH was not detectable. So obviously, I restarted the medication again, and then I saw the endocrinologist, and he told me, okay, we can take for another maybe 2 years, or if we want to stretch it out, maybe 4 years. But if nothing works out, you'll have to take radioactive iodine. Or you want to do radioactive iodine now, you can even do it. So I remember asking him this, does this mean if I took radioactive iodine, I will never get the thyroid eye disease? Because that's like the worst. I didn't mind about everything else, but the eye disease was like the most damaging one. And the thing he told me was, no, you'll always be at risk of it. And you might even be more at risk if you take the radioactive iodine. I was like, what on earth is this? So that's when I pulled a hard stop. I was like, okay, it's time for me to start to see what is really going on, because my thyroid has been working fine for 30 years. Why suddenly it just decided to act up? And even this definitive treatment was putting me at risk for another issue. So that's when I started to stop, and I was reading and reading and reading and studying up. I was just desperately looking for answers. And somehow this clinical hypnotherapy found me. I was studying it, I was learning about it. And then I thought, okay, maybe let's see what this grave disease is all about. And I went through whole therapy. It was an emotional therapy. I cried a lot. I dealt with a lot of my emotions. I let go a lot of things because I remember my medication, we could reduce it to, I think, 5 days a week. And we could never reduce it anymore because I was taking my blood test. Every time we reduced to 4 days, and you can see the levels were just off again. Go back to 5 days, then it was stable. So I thought, okay, let me try this therapy on clinical hypnotherapy on my issue. And I saw every time I did a session, I dealt with it. Then I saw the drugs, the medication was just too much. Like you can see that the TSH was so high and then the T4 was so low. And then, okay, I could reduce it some more. But every time I did a session, I could see the changes in the levels. So that's how I slowly just got it. Like I was medication free. The endocrinologist not happy. When I saw him, I told him I'm no longer on medication. I was like, what is this? We agreed 4 years and it's like 1 year and you're suddenly off it. I was like, no, I feel great now. Like I could tell my body was different. I could tell that I didn't have it anymore. I could tell that it was okay, because the first time round I was carrying like extra medication with me just in case, like, oh my God, it might be a flare up. I don't know when it's going to flare up. I want to make sure that I have so much medication. I had so much medication at home, like the carbimazole just to stand by. Yeah, but the moment it was gone, I felt it. Like I felt great. And I just got rid of all the medication.
You see, Selena, you said something that is so powerful. What you were dealing with was emotions that was totally suppressed. So what is not expressed, it's going to manifest in health conditions. In your case was autoimmune condition. In my case, it was adrenal burnout and hypothyroid. Yes, hypothyroid can lead to, you talk about Hashimoto's also, it can be on a hypothyroid. And a lot of people, it's cancer, right? And when you talk about cancer, I always ask, is it the right breast? Is it the left breast? Because I can't remember which one. It's actually one is due to spouse issues, and the other one is actually due to like mummy issues. So it's got a lot to do. The root cause is again it's emotions. You
Yeah.
see that emotional aspect is so important. We always sometimes we're just not aware that we are carrying so much until you got this condition, you have got this condition, this disease, this medical, whatever the issue is, and then we have to pause and okay, where do I start now? What is it that I'm carrying? And this always boils down to emotion.
I see a lot of autoimmune these days. Do you think that is also why there's a rise of autoimmune? No one's dealing with, there's all these suppressed emotions inside.
Yes, and that's true. Anything that is literally suppressed, it's not healed, it will manifest. So if you look at it, right, when you talk about the future medicine, it's going to be energy medicine, right? Because we are energy beings. So, and I think what I was so drawn to pranic healing, can I just explain a little
Yeah,
bit about
yeah, yeah.
pranic
Talk
healing?
about it.
Because pranic healing is based on principle. Now, pranic healing is also scientific evidence because when you look at the pranic healing books that, so I've currently done my level 4. Level 1, 2, 3, 4, you can see the books is all this. It has got references and it's just like opening a medical book. The only thing is the anatomy, everything is there. The only thing is we are dealing on the energy aspect. So the principle of pranic healing is basically what we are dealing with is our bodies, we have chakras, right? So chakras are like the meridians, in Chinese, they call it the qi, right? So the chakras, what we are doing is we are just basically, we are cleansing and we are energizing, we are balancing our chakras. We are balancing the energetic part of it. Because all disease, once it manifests physically, you see, on the medical school, we are taught to deal with the physical aspect in pranic healing or Reiki, because I don't know much about Reiki, but I know it's also like an energy thing. But pranic healing, it's basically you are trying to prevent or heal the energetic part before it manifests in the physical aspect. And it really works. I mean, from what I've been learning, and of course, as pranic healers, we practice on one another. And I volunteer at the healing camp, and the feedbacks that you get and all that is just really, really interesting.
Can you share a bit more? Like, how do you use it in, like, say, your daily practice with patients?
Use pranic healing for them yet because it's something that of course when you want to heal someone you have to get their permission. You cannot just be a savior and try to heal and to see whether they're open to it because not many people are aware of all this Reiki and pranic healing. For them it's also like a woo. But where we derive the energy, the prana is energy, we're getting it from our environment and a lot of it is from the sun, from the environment. So when we are drawing the energy from them, but we also use a lot of color pranas, color energies, and we just channel to the chakras, whichever area that needs healing.
As I'm talking to you, I realized that actually, treating people, patient, like holistically it's so underrated. As in, we talk about it, but we don't really practice it. So, like all this prana healing, and I'm sure it's not new. It's probably that like ancient times it was there, and then suddenly came modern medicine where we have drugs and pills and surgery and all of that, and we've forgotten the what was there before that, and now we're trying to go back to that, like the tradition. I won't say traditional, but ancient knowledge of healing. So I think the key here, from what I'm understanding, is that this is how we deal with it, right? Western medicine definitely has its place. It can fix the current ongoing issue like quickly, like just get the body stable, and then after that, what is the other holistic ways you can go to the root cause? Because once someone, I mean, if I'm gasping for air, you can't do your pranic healing on me, right? You have to deal with that pressing issue. But after that, you can actually take your time to really go down to the root cause to figure out what's really going on. So there's no this versus that, but like how does it all come together?
And, Selina, that is going back to the basics, right? So I've got nothing against allopathic, yes, because we need a certain drugs at certain times. So use it when it is needed, right? But a lot of it depends. To me, it's if you're going to use it to basically address your clinical symptoms, then you are missing the root cause, right? So to me, this is going back to the basics. And that's what I like about integrative because, we are going back to our biochemistry during our medical school. And the funny thing is when we have become a doctor, we are just taught to prescribe drugs. And, one of the things, let me show you. You see this chart? This is the methylation cycle by Amy Esco. So I use this to explain to all my patients when they come as to why it's important to address all at the cellular level.
The last time I saw that was a medical student. I probably don't remember it so much now.
Yeah, it's going back to the basic. So and when you show them, you explain to them, and for some of them they'll start taking notes. And I think those are the people where they understand better, and we are helping them to make a conscious decision for themselves. It's up to them. You want this, you can take this. You want to address the root cause, we have this. And how about we integrate? How about we come up with a particular goal plan? We address this first, then we look into this, because of course you want to look into when you talk about the expenses, the finances and stuff like that, let's address what's important, the root cause. And then slowly what? So I will always tell them, okay, I can help you here. This is your responsibility. Trying to get adequate sleep is your responsibility. Trying to minimize the blue light is your responsibility. What you put in your mouth is your responsibility. How many times you exercise, it's your responsibility. So they are also given homework, right? Because we are just there to guide them and to help them put everything in place.
That's so important because as doctors, we think that we are responsible for a patient's health, but then you're disempowering the patients because they are the one that's supposed to be responsible for their health. So what I can see is conventional medicine, we deal with the only phase one, but then there's phase two, phase three, and so forth to get someone to the optimum level. And we just stop there at phase one.
So I guess you know what? It takes a lot of patience. It takes time. And whether do we have that time for our patients?
Mark your calendar for Disruptive Doctors annual conference and exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Earlier, you mentioned about vitamin D. As I'm during medical school and throughout my entire clinical career, like vitamin D is a vitamin. It's not a hormone, but you mentioned that it's a pro-hormone and it actually affects our body. And the only thing I know about vitamin D is that as long as you live in the equator, you'll never be deficient of vitamin D. You'll always have vitamin D. But things have changed, right? Like as a houseman, I go out before the sun rises and I come back after the sun rises. I barely see the sun. If I'm on call, I also don't see the sun on the weekend. I probably see the sun maybe on a Sunday if I'm not working, if I'm not knocked out, right? So there's a lot of us that are vitamin deficient, but we don't know of it. We don't regularly test. So what exactly does vitamin do for
To me, vitamin D is basically it's one of those that it's very important. We look for optimum level, and where it's concerned, like when you talk about chronic fatigue, fibromyalgia, it prevents that at an optimum level. When you talk about mental health, seasonal affective disorder, especially places like in European side where they don't see the sun for months, they are deficient in vitamin D, and of course, they actually need that. And when you link with vitamin D with insulin resistance, it plays a vitamin D. It's also linked to polycystic ovarian syndrome. So it literally, to me, it's a home on its own, and it has so many functions. It goes beyond. You talk about just the bones, right? Where the children, it's rickets, osteomalacia in adults. It's got so many functions.
what is the optimum number for vitamin D? Because the range is actually huge, right? Like I think 12 to 250 or something.
Yeah. So I normally keep my patients at 150. They always say do more than 250 is toxic and all that stuff. But a lot of them, when they come, they're below 50. So like 50 to 75, of course, less than 50 is deficiency. 50 to 75 is insufficiency. And then 75 to like, 150 or something of that sort is like optimum. More than 75 is optimum. But I keep theirs at 150.
Is vitamin D toxicity a real thing?
Because I have never experienced, and some of them they said, oh, 10,000 IU is too much, it can lead to toxicity. I'm like, no, if you just do your research, it can never lead to toxicity. So for those who are deficient, I always start with 10,000 IU on a daily basis. Of course, some of them they prefer the injections, you take that 50,000 or whatever, and then you monitor. But on a daily basis would be like 10,000 IU, and then probably repeat your levels in about 3 months. And then, most of them, they just need to maintain with 5,000 IU. Because I attended this conference and I still remember till today, it was quite some time back, maybe about 8, 9 years ago. It was in Mumbai. And there was this endocrinologist from South America. So she deals with patients with psoriasis, autoimmune condition, and the levels that she would give is actually the dose is 50,000 IU on a daily basis. Now, 50,000 IU, yes, you require to monitor the vitamin D level, the parathyroid hormone levels, the calcium levels, the corrected calcium at 50,000. Nothing, not with 10,000 or something of those sorts.
Well,
Yeah.
yeah, and if it's 10,000, you're ingesting it orally, so whatever that's bioavailable will probably be a lot lesser than that.
Absolutely, absolutely. And of course, always say that look at your diet, try to consume as much as, we're talking about the fatty fish and all that, whether it's your salmon, it's the tuna, mackerel, and then your eggs, right, including your egg yolks, all those. Try to get as much as you can from your diet. But the interesting thing when I discovered about vitamin D, those were the time everybody was focusing on vitamin C. Nobody talks about vitamin D. When I started doing the levels, and one of the reasons I actually do the levels, for me, it's so much easier to convince the patients because I had a lot of when I was a global doctors, you deal with a lot of Caucasian patients, right? And a lot of children, they go to Garden International School. They were like, no, my children. But sometimes when you talk to children, they come with one fracture. After like several months, another fracture. So obviously, I knew this child is deficient in vitamin D. But the parents will say, no, my child has, very, very active in, PT. They're always playing football, playing this, very active. And I know, really, I hear you, great, but let's just do a baseline, because I wanted to convince them, hey, you need to see what the reality is. Sometimes it's our perception. They were all shocked because the child's vitamin was actually deficient, vitamin D deficient. And this is a child who is always out there. And for them, it's like, how come? So for those patients, I would probably say, look, sometimes there was a point where I used to do a lot of genetic testing. I did it on myself. I did it on my, husband then, and my children. We are all deficient. So there is something called as, the genetic rate limiting enzyme deficiency. So from the sun to the skin. And then, you have the other one from the skin to the liver, it gets goes to liver, it gets activated to vitamin D3, calcitriol. So in one of those steps, in the rate limiting, if the enzyme is deficient, it cannot get converted, no matter how much you are out in the sun. And guess what? 90% of us are deficient. When I do all the blood tests, insufficient, deficient. And being Asians, right, the darker your skin is, the more melanin we have, the production of the vitamin D gets even more decreased, diminished.
That's very interesting because, yeah, you're right. When I tested my vitamin D levels a couple of years ago, also it was low, and I started myself on the supplements.
Yeah. It's linked to autoimmune condition, right? So one of those, when it's linked to any autoimmune conditions, whether psoriasis, rheumatoid arthritis, any of those conditions, SLE, I always look into the hormones. The important one is DHEA sound bait. You address the adrenal and the vitamin D and the diet. That's it.
Okay, so what sort of protocols can doctors use to implement, in their clinics with their patient to help them balance their hormones?
I don't think there's any hard and fast rules when it comes to protocols. I guess what is important is when the patient comes to you, always do a very detailed, thorough history taking, understand their lifestyle, understand their childhood, any medical history, any childhood trauma, just siblings, and then do the very detailed profile when it comes to hormonal profile, all the vitamins, as I mentioned just now, the vitamin D, the homocysteine, the C-reactive protein, just do the full thing. Then when it comes back, just go through go through, address all that is suboptimal, you optimize that, what is deficient, you restore those, and then go back to the diet, go back to the exercise, the sleep, the stress management.
Yeah, I think sleep is one thing that's like really underrated. Even for me, when I was a doctor practicing, I would ask them about the food, their exercise, but I never touch on sleep ever.
Because at the end of the day, right, I guess you also realize the minute those were the days, you can go on like, being on call, you don't sleep, you can function well, right? But these days I'm like, oh my God, I don't think I can even do a single house call. So it's something that, we always say, as I learn about hormones, what is specifically mentioned is majority of us, majority between like 11 p.m. to 3 a.m. That is when your hormone starts to peak, your body restores and it heals, it rejuvenates. So that window period is actually quite important for most of us. So I'll tell my clients, rather than going to bed very late at 1, 2 o'clock, why don't you go to bed early and wake up early? So during that period of time, body can recover.
Oh yeah, I think that's so important because yeah, doctors, we won't sleep, right? If you're especially on call, you get to sleep the next day, 5 p.m.
Absolutely, absolutely. So everything just goes haywire, right? All our circadian rhythm, it just goes haywire.
I've also noticed that a lot of nurses in the ward, they have metabolic syndrome. Do you think it's because of the hours? I mean, the shift system, they're working at night, graveyard shifts, and all that. Is that the main cause? Because I've seen them, they're not overly obese. They're moderate size. I won't say they're obese, they're just average sized. And they all have like metabolic syndrome, and some of them are on really high insulin.
It's a very interesting question you asked me because there was a point of time where I was very intrigued with a similar question. And I noticed all the maternity ward, especially in the hospitals where I was, pediatric, we deal with a lot of, gynae, all the on-calls and all that. And I noticed majority of them, they were actually obese. And then I found this study that linked all those sleep deprived doctors, nurses. Why? And guess what I found? The hormone ghrelin and leptin. So leptin keeps a person slim, right? You have a lean body, so especially those who sleep well. But those who actually, like the graveyard shifts and stuff like that, where they don't sleep, their ghrelin peaks. And the ghrelin is what leads to metabolic syndrome, obesity, and stuff because they lack in leptin. And I'm like, wow, that is so true.
Wow, this is such a like oxymoron. They're healthcare workers, but they are the most unhealthy people.
It's really sad. See, but you see, those are the people that you have to go back and look into yourself, right? You just need to have a balance, right? It's just, I think our body is created in our evolution. So talking about evolution, now, have you noticed a lot of people, they're being vegan? A lot of people, they're vegetarian. And when they come to me, they say, poor animals and such as some of them, they can be so judgmental. I'm like, wait, hold on. Have you seen the blood profile of those people who are vegetarian and vegan? So what I see, the common pattern, homocysteine, right up. Protein, the albumin and all that, 35, 36. So a lot of them, they're protein deficient, they're vitamin D deficient, their homocysteine is totally elevated, which means they're vitamin B deficient. And to me, you say that you are killing the animals, but what about, for, those people who, whether they are farmers and all that, where you cut off all the shrubs, the paddy fields or whatever, you are killing I call them the lower sentient beings. They are the squirrels, they are the rabbits, they are the butterflies, the insects, they are also living beings. So at the end of the day, I said, to what extent? At the expense of your health? Because at the end of the day, if you got to be an optimum health for you to be able to help the others, if you feel guilty killing animals, then do some charity work. Support the animals in whichever way that you can. Because when you look at evolution, we were hunters. We ate animals, right? It was a carnivore diet. It was a Paleolithic diet. Then came all the grains. When the grains came in, then came all the autoimmune conditions, rheumatoid arthritis. Oh my God, I had such a tough time trying to convince my mom, who was diagnosed with rheumatoid arthritis, because I knew the one thing that triggered that was actually, the staple diet is actually chapati. So me trying to tell her, Mom, you cannot eat chapati because this is one of the things that, is leading to this. And she will say, how can you tell me that with all my life? I ate chapati. But I'm like, Mom, I mean, how to explain to her the term of GMO? Those were the days it was very different in Punjab. But these days it's different. They add fertilizers, they add all sorts of things. It's all genetically modified. It's really hard convincing. So coming back to that thing, you talk about balance, you talk about evolution. It's going back to the basics again. We are not meant to be vegetarian. And I'm going to talk to them about ruminant. You talk about the ruminant stomach, right? That is meant animals. They can feed, all that whatever vegetables and stuff. Don't have human beings don't have ruminant stomach digestive system. Just is like 40 to 60, I think 40 to 60 meters. Was it 40 to 60 meters? It's very long, right? They got 4 compartments. We humans, we got only what, 7 to 8 meters. So you cannot compare. So we are trying to change everything, but that's when it leads to all sorts of issues. We cannot absorb all this vegetarian stuff. So there again, it's going back to the basics.
So should we still be eating vegetables?
We can still eat vegetables. I'm not saying don't eat vegetables. You can still, but don't forget your meat. Because at the end of the day, when you look into your liver enzymes, when you look at your albumin, so I always look at albumin levels. Albumin has to be above 42. Anybody whose albumin level is less than 42, they're already lacking in protein.
I also recently, not so recently, maybe a year already, I've been on a low carbohydrate diet. I've stopped. I mean, I won't say it completely, but I've reduced bread, rice, all the pasta, noodles. And you know what? I actually feel great. Like all the GI issues that I used to have, I thought I had IBS, it's all disappeared. Like all of it. I was so fascinated with it.
I had the same experience too. Yes. So I guess, when you talk about all these refined carbs, we just have to cut it out. But the complex carbs that comes from our vegetables and stuff like that, go ahead. Yeah, I used to be, like so, like a zombie after having like biryani rice, and I never knew why, and it's after that, it's like, oh my God, it's like the amount of carbs, the amount of sugar load that comes after that, I just plunge. You have that spikes of your insulin and your glucose.
Okay, so is there any foods that can improve the hormone health?
Yeah, so a lot of the hormones actually thrives on protein. So a lot of my patients, when they come in a diet, I'll tell them to have adequate amount of protein, right? Because the protein is where the protein synthesizes your hormones. And of course, the other one is your, so when you talk about protein, it could be your white meat, it could be your fish, it could be your chicken. You want to eat lamb, eat your lamb, turkey, but turkey here is not very common. And of course, it's expensive, but in the Western world, they can get lots of it. And then comes your fatty food, right? The good fats, right? Where you're talking about your avocado, from the coconut oil, the MCT oil, anything that you can derive from the good fats, by all means, especially those. Yeah, then of course it comes to your complex carbs that you get from vegetables. So it's all about a balance of a healthy whole food.
What's the biggest misconception you've encountered, about hormones, whether it's from patients or it's from doctors?
I think a lot of it is like, oh, hormonal imbalance. We always talk about women. Hey, what about the men? Yes, we go through menopause, but they go through andropause. It's just that I guess some of them are in denial. I guess for a lot of men, you see, when you compare their testosterone levels, right, when it declines, it's very slow, it's very progressive. Whereas women, it's like, ooh, it's such a rapid decline, and our symptoms are more dramatic. Yeah. So that's why we all feel it more, and that's why a lot of the focus is on women, but men, they go through that as well. So I guess that's one of the misconceptions. And a lot of them, especially now when I'm managing a lot of menopausal symptoms, preparing women for it, one of the things I have to talk to them about is they all have this, thanks to the studies of the WHI in 2002, hormone causes cancer. So the safety about hormonal treatment, it's explaining to them why you feel that it's safe. And at the end of the day, yes, it is effective, it is safe, depending on how it's being prescribed. If it's prescribed appropriately by a doctor who's trained, who knows what he or she is doing, then it's all safe. And then the personalized treatment is so important because there is no one size that fits all. We are all very unique beings. So do a personalized protocol for each of the patients that walks through your door.
So for andropause, like, do men need to go through testosterone replacement therapy?
Yeah, a lot of them do, and I've seen a lot of them now, even at the young age, as early as their 40s, because of the environment, because of their stress. Their free testosterone levels are literally very low. So for those, I would probably support. I put them on TRT, because it helps them to restore their testosterone levels, but also addressing cause, and then taper them off, because you cannot put them on high levels. Feedback mechanism, especially for those who want to start family and all, it will suppress their testicular production of testosterone. So you've got to be aware of this.
Okay, do women also require testosterone replacements?
Yes, we do. And I love talking about testosterone in women because it just goes beyond the sexual function, beyond the libido. For us, we require for mental clarity, cognitive function, for confidence. A lot of women, the CEO level, before they go in, including myself, our rocks on testosterone. Then you talk about our muscle mass, right? Perimenopause, menopause, we lose a lot of muscles. So that's when it comes in. And then, a lot of women, they actually have varicose veins. But clinical diagnosis, if you see varicose vein, you need to look at the testosterone levels. That means they're deficient in their testosterone. And then you talk about your osteopenia, osteoporosis, testosterone plays an important role. So there, you see, it's your mental health, your moods, your sexual, your libido, your muscle mass, your bone health. It's got so many functions.
Well, I never knew it has so much, like it really helps the entire body function.
It does. And for women, we only need a small amount. Don't give like the masculine, male. Well, then we'll be asking, so now who wears the pants? Just a small amount. Normally I rarely go beyond 2.5 milligrams for women. Yeah. And it depends the quality of compounding. It will be absorbed. Micronized testosterone, good quality, is more than enough. I rarely go 5 milligrams or 10 milligrams. Yeah.
So do they need to take a blood test to see the levels first before starting this?
I would advise when you do the hormonal profile, include the free testosterone. We always want the free, because I noticed some of them, when they come with a profile right done in another clinic, it's always the total testosterone. No doubt, free testosterone is a bit more expensive, but if you do the total testosterone, there is a formula you need to use to calculate to derive the free testosterone. If I'm not mistaken, it comes under sex hormone binding globulin. You got a total testosterone, and you need one of the liver function tests. It's on the liver function. You need to use that. But certain places now, the free testosterone, it's not expensive. It's only about 75 ringgit doctor's price, because I get mine at one time premier.
So what's the difference, like total testosterone and free testosterone?
See, the total is always the bound levels. We don't want what is bound. When we talk about cellular levels, right, we're talking about the free, just like free T3, free T4, because that's the one that is available to travel around home into our cells.
Okay, I have one question. I think this is mostly for me. Like for women who, are athletes or they play sports, like how can they leverage their hormone cycles? Because, on day one of menses, day two, I'm practically incapacitated. I cannot do anything. So how do you leverage this maybe for like performance training or building muscles? Like how can they use this?
From what I know, right, I mean, hopefully these are people who have a very regular cycle, so you can tell, their menstrual cycle, right? So you have the follicular phase, you've got the mid-cycle, you've got the luteal phase. So from what I know, is like those who are, especially in the follicular phase, where the estrogen is actually, they would have finished their cycle, so their menses. So that's the point where the estrogen levels is low and then it is rising. So that's the time where it's actually good recovery. So where it's good recovery, you can go for, high intensity strength training. Then when it comes to the follicular, there is actually a bit of a rise of the testosterone as well. So which is also good. So you can do a bit of a, moderate. The luteal phase is where I think where the progesterone peaks, and just before your cycle, that's the time where the recovery is a little bit slower. So go for more of the light intensity. Don't go too high. This is just like a general, like a rough gauge. But most importantly, just listen to your body, because many people these days, it's never regular.
Okay, so for doctors who are listening in and they want to start helping their patients and treating their patients, like, do more for their patients, like, where should they start?
Start by listening to your patient. When they come to you, obviously, there's a reason. If they are well, they will not be in your clinic. And if they come to you, just listen, ask a lot of questions. Sometimes, you know what, patients, they may not even tell you some of the symptoms that is important, because to them it's not important until you have a lead questions. When you ask, like, when it's, so for example, when you're talking about whether it's hormones, it's very important to ask about the cycle. It's very important to ask about their moods, how are they coping, whether they are feeling depressed. And some of them may not even tell you that they feel depressed. until you ask them, tears will just come streaming down. So ask a lot of questions. First listen, then ask a certain big questions, and do the very thorough protocol, lab tests, so that you're able to address what is the main reason they're in your clinic. And it can be very rewarding once you to address those. And I can tell you a lot of the kind of clients that I see, a lot of them have adrenal burnout along with underactive thyroid. So these are the ones you see in the 30s to early 40s. They might come to you and think, hey, I think I'm, early menopause. But most of them do not. They're actually thyroid issues, adrenal issues. They're low in their vitamin D. They're high in their hormone cysteine. So when you address that, it's really life changing for them, and it's very rewarding for us that we are able to help them.
Okay. Dr. Sangeet, is there anything that's like really important that do you think the audience should know, which we've not discussed about?
I think we covered quite a lot. And I think the important part that we were addressing is actually the optimum level. So my message to our doctors, our colleagues, is basically trying to get your patients all in the optimum level, because optimum level is literally the true determinant of how a patient feels and look. And, at the end of the day, when the hormone level comes back, it's like literally, it may be within the range, but it's like literally on the lower line. The body is really screaming for help, right? So always address and try to bring them to the optimum level.
Okay, so the one final question for you. How do you see yourself impacting healthcare differently?
I guess, for me, it's always integrating new things. Like now I'm learning homeopathy. I'm learning the slow dose medicine from Dr. Tariq Jatma, right? So it's very interesting and it's quite deep and there's a lot to learn. And plus for me, it's this integrative aspect, it's in the pranic healing or the energetic. So for me, it's all about integrating and always addressing the root cause.
Okay, thank you, Dr. Sangeet, for this very, very exciting, incredible insights. I really enjoyed the conversation today. You've opened my eyes to so many things about hormones. So for our listeners out there, remember to check out our Disruptive Doctors Conference that's happening this 20th and 21st of September, where like-minded doctors like you come together to share ideas and impact healthcare differently. And also remember, our Disruptive Doctors app is out. Be sure to download it. And that wraps up another episode of Post Call Beyond the White Coat. Until then, I'm Dr. Selina. Take care and keep disrupting the norm. Thank you.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact